So we have a few questions, and you've mentioned problem-based learning, PBLs. I've also heard rumors of the spiral technique used at Notre Dame for your teaching style. We have some questions about like how it's graded. Is it pass fail? And I don't know if some of the students maybe know what problem-based learning is. So maybe you could just address what that is, and then we could have one of our student panelists talk about their experience of it so far.
I nominate Paul.
Thanks, Chris. So problem-based learning, is that initially what you want me to start with? I can also address the assessment question and the spiral pedagogy that we use within the curriculum, but where would you like me to start?
Maybe with problem-based learning and then the spiral.
Yeah, awesome. So problem-based learning is really, as it says in the name, it's coming into a small group, like let's just say 10 students all coming together. You all come from different backgrounds, so you're all bringing your own experiential learning and also, previous undergrad experience into that room to really talk about and unpack a clinical scenario that is presented to you, on the screen. So a simulated clinical scenario. It might be, a 65-year-old male presents with shortness of breath and is cyanotic in an ED emergency environment. So as a group, you unpack, what is everyone's base knowledge? What does shortness of breath mean? What does it mean about gas exchange or VQ mismatch? What does cyanosis mean? How does that present? How do you see that visually? And throughout the course of, PBL, it's usually a 2-hour, length. You'll come up with your own set of learning objectives. So what do you want to go away and learn that week between PBL 1 and the next PBL session, which is usually a couple of days later? We use a hybrid PBL method as opposed to a purist PBL method that they use in other medical schools like McMaster University in Canada. So the school provides you with resources such as lectures or clinical skills or science laboratories or Aboriginal health or population health learning between PBL 1 and PBL 2. And then you'll come back as a class and you will share with each other what you've learned around those learning objectives. So it's a really adult-centered learning, team-centered learning, peer-to-peer learning, and it's develops, I think as Hetty said in one of her chats, although she's had to leave because she's got clinical skills at 8:30 this morning, develops your clinical reasoning skills, which is really what the PBL program is based around. And a lot of medical schools internationally, not only in Australia, use that style of learning. And in terms of the spiral learning, we often use that language in the educational pedagogy world. So we will introduce you to a topic in year 1, and it might be about, let's stick with the lungs, the anatomy of the lungs and how gas is exchanged in the lungs. And then throughout year 1, we will layer on other topics on top of that and to give you a broader concept. So we start small and then we layer a more complex topic, so we might talk about gas exchange in diseases like asthma or tuberculosis or COPD. So that's what we mean by spiral learning within the year that you're in, but it also works across the year that you're in. So we start by teaching you what is normal in year 1, like normal physiology, normal biochemistry. In year 2, we'll layer that on with a pathophysiology lens. So how does gas exchange work in the context of a disease such as asthma or TB? And then you'll take that knowledge into your clinical years. That starts really from year 1 all the way through to year 4. How does that disease present? How do you manage it? How do you treat it? What are the clinical signs and symptoms and investigations, et cetera, So that hopefully gives you a flavor of what problem-based learning is, as opposed to something else like case-based learning, and what we mean by this spiral curriculum within the year and across the 4 years of the MD program.
Yeah, that's awesome. So you do a lot of problem-based learning. Is there lecture-based learning as well? We had a question about what the class sizes are, and I'm assuming that would change between like problem-based learning groups versus maybe larger lectures, if that's how things are run there.
Yeah, sorry, so you were cutting out a little bit towards the end there, but so we do
Oh,
have
sorry.
no, that's okay. That's all right. I mean, so problem-based learning is the core pedagogy of the MD program, but we do have a lot of other styles of resources, lectures, for example. So lectures are, they're online at the moment. Well, yeah, that, and they probably will continue to be online. But so that's 100 students zooming into a lecture style format. But we do clinical skills. It's all small group learning. So PBL, clinical skills, clinical debriefing, or is all in small groups. Our journal research clubs are in small groups, but we do have the larger science laboratories, which at least here in Fremantle, we have about 30 or 35 students per science lab, and yeah, and then the lecture style format as well. So it's really what we call a hybrid PBL process, where we expose you to lots of different resources throughout the week to help you sort of teach you and to help you with the learning objectives that you've come up with in that PBL scenario.
Awesome. Thank you. And this might have various answers as well, depending on the course. But are they typically graded, or are they usually pass fail?
So that is a very good question. So currently at the moment we have a mixture of assessments, and I know that this might be changing in a few years with us moving to a national curriculum. But so our continuous assessment items tend to be a mixture of pass, fail, or graded. And certainly our mid-year and end-of-year exams are graded exams, as are our OSCEs, which is our sort of practical assessment of assessing you on how you know to take a history or an examination of a certain system. So it is a mixture at the moment of graded and pass fail. It's probably the easiest way to answer that.
Yeah, I think a lot of schools do mixed, but it's a question we get from students quite a lot. So I wanted to make sure that we got it in the session today. I guess we're kind of coming to the end of time. We actually ran over time, so I appreciate you guys taking the time to be here today. But I guess, Rhea, just one final question for you. After talking about PBLs, the spiral technique, how as you, as a student, how have you found that? Is that something that you're enjoying? How does it compare to your undergrad? Just final thoughts on that, maybe?
Yeah, if you came from a larger university, you'll find that they're quite didactic. It's quite lecture based, but for problem-based learning, I think of it as once we're doctors, we will communicate and work in a multidisciplinary team. And that's kind of what the PBL is trying to foster. You'll get a lot of thoughts from other people, and you actually have to engage with that. So that's kind of like the the whole point of PBL. I do find that my PBL group from last year, they're one of my closest friends now. Just for example, I had a PhD student in my PBL last year, and he just graduated this year. And even though we're in different PBLs now, we all went to his graduation. Both our tutors went as well. So that's kind of the more social aspect of PBL, is that you really find your found family. And then, yeah, I would say it really also forces you to develop your critical thinking. So just because you're presented a case and maybe you think it's asthma or diabetes, you have to explain as to why you think that's a diagnosis, which we don't really do in real life. Sometimes we just see patterns immediately, but really taking your time and slowly explaining that then builds on your clinical acumen, which PBL does. So.